Welcome everyone. Thank you all for being here. What a great group, great turnout. And I'm just so excited to talk about HealthTech Arkansas tonight. So we're gonna have a couple of speakers after me, and then you will get a chance to hear from these 6 outstanding companies that we're bringing into Arkansas. I'm Jeff Stinson. I'm the director of HealthTech Arkansas. I manage both the program side of what we're doing, working with these companies, but also our investment fund that we set up to invest in these companies. If you think about all of the programs that we do across the state of Arkansas with our accelerator programs, which, you know, the governor has been super supportive of our accelerators. We have the FinTech Accelerator that the Venture Center conducts. We have ours. We have 2 or 3 others that AEDC supports. And all of us have to think about, how do we differentiate ourselves? How do we get the best companies in the country and the world to come to Arkansas and participate with us? So the way ours came to be is last year we started with 2 partners, right? We started with UAMS and Arkansas Heart Hospital. And we knew we had to differentiate because most accelerators around the country are anchored by big healthcare corporations, the Medtronic and the Baxter and J&Js of the world. We don't have those big healthcare conglomerates here in Arkansas, but what we do have is outstanding hospitals. So without knowing anything about us or accelerator programs, UAMS and Arkansas Heart Hospital went out on a limb and they guaranteed that for all companies that were admitted into our program, they would guarantee a pilot project with those companies. And that is an extraordinary commitment because no one else in the country makes that commitment. No other hospital in the United States will make a commitment to do pilot projects with early stage companies. So they made that commitment, the floodgates opened, we got tremendous number of applications from all over. Ultimately, we had a great program, and now we've turned it this year into, now we have 9 providers across the state of Arkansas who have joined our coalition. We're super excited about that. All 9 of them are doing pilot projects with the 6 companies who are coming to see us this year. So it's just working out really well for us. Our team, I said this earlier today, but if you want to, there's an old saying, if you want something done well, give it to the busiest person in the room, and that's what we do at HealthTech Arkansas. This entire team has a lot of different things going on professionally, but I think that's the secret to our success, is this team makes everything work because they manage all of their responsibilities well, and they bring their time and talent to what we're doing as a program. So we have 2 program tracks, and because the governor is here, I'm going to tell you how each of these are important to the state of Arkansas. The first track, which is sort of the core HTA track, is what many people think of when they think of HealthTech Arkansas, which is we go out and find these really highly accomplished companies outside the state. We invest money in them. We bring them here to Arkansas and connect them for pilot projects with our hospitals. That helps the state of Arkansas in a number of ways. First of all, we're exposing our hospitals here to the best technologies emerging in the marketplace today. That increases quality of care, makes our hospitals more efficient, and improves the health care of all Arkansans. Secondly, if we can get these companies connected to enough providers in the state of Arkansas, they absolutely will open offices here. Walmart is proof positive of that. So much of the Northwest Arkansas growth has come about because, as we all know, vendors open offices there to call on Walmart. The same thing can happen in healthcare, and we're trying to replicate that by bringing these companies in to work with our hospitals. And the other way they help, honestly, is they just raise the caliber of entrepreneurship for all of us. They give our investors a chance to invest in these companies, and they raise the level for all of us. But the second track, which gets less publicity, is just as important to us, which is we have a separate parallel Arkansas track for the Arkansas-based startup companies in HealthTech Arkansas. We have about 60 companies on that list, all inside the state of Arkansas, and they range from something no more than a founder with an idea up to an established company with products in the marketplace, right? So all of those early stage companies need provider access. If you're developing a technology that benefits a hospital, what do you want most of all? You want to work with a hospital. but hospitals are tough to get into, right? So what we do with our program is we leverage that to engage Arkansas's company with the providers so that they can get the advice and mentoring and guidance that they need. We think that is working out really well. We've started with our first group of 10 of our companies based here in the state. We've done needs assessments with those. We're now connecting them inside our hospitals to get the support they need. All right, so a couple of different groups. Clinical Advisory Board, we have groups of clinicians all around the state at our partner hospitals. What these folks do for us is three things. They help us vet and screen applications. When their organizations do pilot projects with our startups, then they champion those pilot projects and make sure it's successful. And the third thing they do is they have agreed contractually with us to work with the Arkansas-based companies because we know that's important, so we actually wrote it into their contracts. The second group is our Strategic Advisory Board. So this is more national in scope. What we have done is we've identified people nationally who are doing things at a very high level in healthcare innovation. Partners at healthcare venture capital firms, the head of digital health at the American Medical Association, the head of Mass Challenge HealthTech, another accelerator program like ours in Boston, and we're putting them on an advisory board with two of our hospital executives here inside the state to help us shape the strategy so we can make HealthTech Arkansas the best it can be for both startup companies and for our hospitals here inside the state. All right, so a little bit of our applicant pool, right? So we had applications this year from 18 different countries, and I don't know how companies in Bahrain and Israel and places like that find us, but they do. And I think the reason they find us is we're the only program offering these pilots with hospitals. So our applicant pool this year substantially increased in size relative to last year's program, but even better is the quality improved. And we have people self-selecting out now because we've become synonymous with accepting only the best companies in the country into our program. Here are the companies and where they came from. And if you look at that on a map, it's where the healthcare innovation centers are in our country. Our selection committee, which has about 20 people from our hospitals across the state, and those 20 hospital folks and providers, they actually chose the companies that get into the program. They did not start out to choose 2 companies in San Francisco to be in the program. They didn't choose for all 6 to be on the 2 coasts, right? It's just that when you evaluate these types of companies, that's statistically where they're most likely to be the most well-developed and well-funded early-stage companies, and that's where we found our companies. So last year I was standing up here and I said, it's a first-year program, I said the companies, the 6 companies we brought in, they collectively had 46 employees and $15 million of external capital raised to date. And I said that is the most accomplished group of early-stage companies to work inside the state of Arkansas in any one industry at one time. And I firmly believe that to be the case. But what happened is this year came around and we substantially increased that. And my takeaway from this is that if you think about the value proposition of what we're offering, it doesn't matter if a company has raised millions and millions of dollars and they've got 100 employees, whatever it is. The ability to come in and tap into 9 providers at once and do the types of pilot projects that you want that really move the needle, that has just really resonated with people. So we're just getting better quality companies, and that will continue in future years as well. All right, so a few numbers for you. 16% of all jobs in Arkansas are healthcare related. We have, if you look at the average wage rate of jobs, healthcare jobs inside the state, it's 61% higher for healthcare jobs in Arkansas relative to all jobs. And if you look at the payroll, and the economic impact is just tremendous, right? A $2.9 billion payroll overall for our hospitals here inside the state, $11.7 billion economic impact. Clearly, this is an industry that's worthy of our support, and we are truly making healthcare a place of innovation right here in the state of Arkansas. So just from an investing side, HealthTech investing is one of the fastest growing venture capital fields in the country right now, maybe the fastest growing right now, as demonstrated by this graph. And the reason that is we all know that healthcare costs are growing at an unsustainable rate. What that does is that drives tremendous market pressure on the private sector to find new technologies that increase quality of care, make our providers more efficient, and decrease their costs, right? So with all of that marketplace pressure to stem the rise of healthcare costs come into play, venture capitalists step in to fill that void, right? They start funding these technologies, and that growth is going to continue. What we have done in Arkansas is we play, from an investing standpoint, a very small part of this. But it's an important part because the private equity pool that we have put here, that's comprised of high net worth individuals inside the state and some of our companies and organizations and providers who all are investing in our fund to invest in these companies, it is a tremendous opportunity for us because we're essentially getting to invest in the best early stage companies that are getting venture capital funding, and we get to tag along with very small investment amounts just because of this program, and we're leveraging the access that we're providing to our hospitals. So my last slide for you, which is just our value proposition, right, is for our providers is we're providing them access to the best technologies anywhere. For our early stage companies, we're guaranteeing pilot projects, something that no one else does inside the country. For investors, they're getting a chance to see and the opportunity to invest in companies that we wouldn't see otherwise here inside the state. And lastly, for the state of Arkansas, we want to create jobs. We want to raise the innovation level, and we want to create jobs both with our Arkansas-based companies and with these out-of-state companies that we're bringing forward. So that's a lot of data that I have thrown at you in one concentrated slot, but we're all really excited about this. So the next person I want to introduce to you, Dr. Bruce Murphy, who's the CEO of Arkansas Heart Hospital. It would be, there's no way I could possibly overstate what Dr. Murphy has done, not only for our program, but for healthcare innovation inside the state. I approached him with this idea a couple of years ago to talk about HealthTech Arkansas and to get his input on it. He jumped on it, and the reason he did is because the place that you're standing right now is literally one of the most innovative healthcare innovation places in the country. They're the third highest volume cardiac hospital in the United States, and the reason they can drive the volume that they do through here with an exceptionally lean staff is because the entire staff here, everyone thinks innovatively. So when you think about us bringing these really accomplished early stage companies here, one of the main draws that they want to do here is they want to work with Arkansas Heart Hospital because they know they love new technology so much that their pilot projects have a very good chance of being successful. So, Dr. Murphy, thank you so much for everything you've done.
Well, welcome. Welcome to Arkansas Heart Hospital. We're delighted to have you here, and we're delighted to host this occasion, and we're so glad to see so many of our representative colleague healthcare providers here as well. I will tell you that we do believe in technology. We do believe that technology is the future of healthcare, and the last 25 to 30 years in cardiology is a shining example of exactly what has happened, because we've gone through this golden age of cardiology in the last 25 to 30 years, and it's because of new technology. And it's new technology that needs to be sorted through, and then the appropriate technologies used. We also believe that in order for us to be competitive in the future, that retail medicine has to be part of it. And retail medicine means nothing more than the commerce of medicine, and that can be open and fluid, and technology has got to be the streaming factor that allows that to happen. So thank you. You're very welcome here, and we are delighted to have so many of our colleague hospitals here as well. I will tell you that whatever you may think, in my world travels, I will tell you that the level of sophistication of healthcare in Little Rock, Arkansas, and in this state is very high. It is far outstrips what you might have the perception of it being, whether it be at any of our colleague hospitals here in Central Arkansas, our clinics in Central Arkansas, or Northwest Arkansas, Northeast Arkansas. The level of the sophistication of the healthcare providers here is quite high. It competes worldwide. And that is something we're very proud of, and it's something that we continue to fight to maintain and to keep. I would like to introduce a man who I've admired for his many decades of public service, who has been a proponent of getting jobs into Arkansas, and well-paid jobs into Arkansas, and has done a tremendous amount of role modeling for the business of Arkansas through leadership, just pure leadership that exudes from every part. And Governor Hutchinson, if you would please come forward, I'd love for you to have a few words to speak. Thank you very much. Thank you very much.
Thank you, Dr. Murphy, for hosting this, and I want to thank all the colleague hospitals that have made this possible. I want to welcome all of the startup companies that are here. I saw the list, and it's pretty exciting to be able to see companies that come from Seattle, from San Francisco, San Diego, New York City, and on and on. So welcome. This is exciting for us to have startup technology companies in the healthcare sector right here in Little Rock. And the reason Arkansas invests in startup companies, the reason that we believe in accelerator programs is because we see the results of it, the necessity of it, and the opportunity for our state to continue to diversify our economy. Now, I'm speaking to some of those who might be first time here, but Arkansas has a very diverse economy, from agriculture to manufacturing to technology that we want to grow in that space, the retail industry with Walmart and on, the global presence that we have from our global companies that are located here is very, very significant. One fact that sometimes you don't realize, we're in the top 10 of the states for jobs created from foreign direct investment. That's the reason we're creating jobs, one of those reasons. And as Bruce mentioned, we've created a lot of jobs, 3.5% unemployment rate in Arkansas, equivalent to the lowest in history. We've created over 90,000 jobs since I've been governor. And we're doing it, and we're expanding the diversity of our economy. I was at the National Governors Association in Salt Lake City, and NASA made a presentation to us. And as they presented, they gave me a car sticker, actually, and it said, "Space exploration begins in Arkansas." Now, then they had the companies that are engaged in space exploration that is located here in Arkansas listed: Lockheed Martin, Raytheon, Aerojet Rocketdyne, and on and on. And so there's a lot of surprises in this state. And so we hope that you enjoy Arkansas. We hope that you'll enjoy our natural areas that are close by. Tourism is our second leading industry. People come here from all over the country and the globe to see the beauty of Arkansas. So while you're here growing your company, make sure that you have an opportunity to see our state. Finally, one of the things that I always talk about is that recently we had a national summit on computer science. And we had 30 states that came and were represented looking at Arkansas as to what we're doing in computer science education. We're the first state to mandate computer coding in all of our schools. We went from 1,000 students to 4,000, 6,000, and this last year we had over 8,000 students taking computer science in simply grades 9 through 12 in our state. We're providing the workforce that's needed for a technology future for our state. Thank you for being here. I look forward to hearing the presentations, and as you grow your companies, wherever you are, we hope that you'll find a home right here in Arkansas to continue your expansion. Thank you very much.
Thank you, Governor Hutchinson, for those remarks. You know, our governor will have a lot of legacies at the end of this day. One of those is, you know, a fairly prominent computer coding mandate that he had mentioned that I think is a long-term vision that does a lot. But he also does a lot for innovation overall and entrepreneurship inside the state. His own accelerator grant program funded through the AEDC makes possible programs like ours and the Venture Center that brings in these prominent fintech companies every year. So thanks to the AEDC staff who are here for all that you do for us. All right, so now you get a chance to hear the 6 companies, right? So what we're going to do with this is we're not going to introduce each one. They know the order they're going to come through. Emily's going to put the slides up here with who's coming up first, and then they're just going to give a couple-minute pitch on their companies, and then we'll be done. So first up, Ken Nelson, Bardy Dx.
Thanks, Jeff. Thanks to the provider partners, and thanks to the whole HealthTech Arkansas team. My name is Ken Nelson. I'm the Chief Commercial Officer of Bardy Diagnostics. Bardy Diagnostics is an innovator in the digital health and remote patient monitoring space with an initial focus on providing the most diagnostically accurate and patient-friendly cardiac monitors as well as implantable monitors. Our initial product, the CAM patch, the Carnation Ambulatory Monitor patch, was thought up by Dr. Bardy in a really tragic way. Dr. Bardy is an electrophysiologist. He's an inventor. He has 250 plus patents to his name. And unfortunately, at the young age of 52, his own wife died of sudden cardiac death. The very problem that he spent his entire career trying to help treat, trying to help prevent. And so a year to the day of her death, he started Bardy Diagnostics to invent the CAM patch. Why are we different? One of the reasons we're different, obviously, is due to the passion and the motivation behind the technology. We do have 50 plus patents on the technology. The signal processing is different, circuit board design is different. Clearly, there's a lot of problems in the space itself. You see the wires of the technology that's out there, and we're quickly trying to become the new standard of care in cardiac monitoring. If you think about the solution itself, we're going from a product with a lot of wires around it to technology that is simple as this, and we're innovating the space, and we're doing our best to become the new standard of care in cardiac monitoring. So appreciate it, and thanks for your time.
We are Royce Labs. We are an artificial intelligence company. I'm going to talk about it, of course. There's one quick comment. I have worked with hospitals in Germany, Netherlands, Europe, different parts, Asia, in the US, multiple places. I've seen workflows, I've seen heart centers, some of the best centers in the world. This is my first time in Little Rock, in Arkansas. This is the first time I'm seeing healthcare here. I can comfortably and confidently say one thing. This is unique. The culture here is unique. I have discussed with people who are enthusiastic about innovation. This is different. I can't pinpoint my finger at this is what is different, but here somehow everybody works together to move the needle, and that's not everywhere. I hope this continues, and I hope more people in the innovation sector, not just in the country, around the world, notice that, and more interesting things continue to happen. With that note, we are Royce Labs. A few years back, I was doing my PhD at Columbia University in New York, was working with the hospital. I was working with patient data, and I needed some information, and I was working with providers, and they also needed some information. And what I saw was that actually, at the workflow, when you're interacting with the patient, there are pieces of information that are somehow hidden in the infrastructure and not accessible. It just takes time. It takes time, you need to do something, you need to go about it. And why is that? It's not that people don't want to give the information. The problem is that data is extremely messy. It's difficult to process, it's difficult to identify information and give it to someone. we, as an artificial intelligence company, built an engine that takes this data, predicts what is going to be required by each of these users in their workflow, and gives it to them. So for example, if you're a provider, you're treating a patient, you are about to see a few more labs which are hidden in the previous visit somewhere, the system knows that and will bring it up. You don't need to go anywhere. This saves time, improves care quality. This organization of data helps everybody around to do things better. Researchers use this to get to research faster. Providers use this to dispense better care. And administrators use this to ensure better quality of care. Detail different interfaces at the point of care used by several folks. Some of the teams, we are physicians, we are PhDs in machine learning, different parts of the world, with one focus, that is to ensure better care for everyone. In the next few months, while we work with multiple systems here, we have a very clear agenda to show that by using this and deploying this and working with everyone here, we can not just ensure healthier patients, we can ensure increased revenue for provider systems and faster research. Help us do this. We are here to learn. Help us make Arkansas our home. Thank you.
Hello, everyone. My name is Josh, and I'm the CEO and founder of HealthNote. HealthNote is a platform that enables clinics and hospitals to easily collect patient information, and we automatically write physician notes. So think about the last time you went to the doctor's office. You walk in, somebody hands you a clipboard, a kiosk, or a portal. They ask you the same exact information every single time you come in, and the first thing the doctor asks you when they finally see you is, what brings you in today? Because they didn't read any of that information. And so physicians now are spending about half of their day on the electronic medical record system, about 6 hours a day, and about an hour and a half a day on what we call pajama time. That means work after work. Folks are using scribes, which are extremely expensive. Of course, there's the potential for transcription errors, and it's a really big problem. The only thing I want you to see in this mess here is that there are little white boxes, and somebody needs to fill them all out. Medical assistants, nurses, physicians, they spend an extraordinary amount of time filling out the electronic medical record system. This is not some 1990s Windows screen. This is a typical EMR used by top 10 EMR. And so what we've created is a platform that, again, enables folks to collect information in a really easy manner. We send out a text message. Text message contains a link. They tap on that link, and we start asking questions. There's no download. There's no portal to sign into. It's really seamless and simple to use. And so we made it really simple for people of any age to use. And what we do is we take all that information, we create a usable, billable, conversational physician's note, and we put that back into structured data into the electronic medical record system. And of course, we can speak multiple languages, so we can ask these questions in Spanish, and then the note comes back in English. My background's in internal medicine. I was staying late after work every single day writing notes, and I thought there had to be a better way. I'm not the only one. Physicians around the country are burdened with documentation, and new documentation burdens are coming out every single year. I got together with my co-founder, Aaron, and we started this company. We're now a team of almost 10. We're live in 5 states, in 10 sites. We have an additional 4 clinics and hospitals that we're working with, and we've got a pipeline of 70 clinics and hospitals around the country. We know there's a huge growth potential here. Everyone is burdened with documentation throughout the healthcare system. And if you'd like to learn more about how we're doing this, come and talk to me after we have this presentation. Thank you.
Good afternoon, everyone. My name is Adil Yang. I am the co-founder and CEO of Medumo. And what we do is make patient engagement easy for hospitals. So if we think about patient experience today, to say it's broken may be an understatement. It's maybe behind its time, where it should be. As a patient, let's say you have a procedure or surgery coming up. You may receive paper-based instructions that are difficult to follow. If you're lucky, you get a phone call from a nurse who tries to explain everything, a lot of information in a very short amount of time that's easily forgotten. And then leading up to the day of your procedure or surgery or clinical visit, you may have a lot of questions that go unanswered, and that anxiety builds up. And we know that when the patient's experience is broken, the hospitals suffer. The most obvious way we see this is when the patients come unprepared and have to cancel their procedure or cancel their appointment, or they don't show up because they're too scared or don't know what's going on, or they've been referred but never actually scheduled for an appointment. All of these operational challenges lead to over $150 billion a year of loss to the hospitals. So the way we are coming at this problem is thinking about patients and meeting them where they are. So we are a multi-channel, multilingual platform that uses all sorts of channels. We're talking email, text, voice, as well as paper, if that's the only way that the patient prefers to be engaged. We figure out which channel or modality the patients prefer, and we deliver instructions in sort of bite-sized pieces leading up to the procedure day by day so that patients don't miss a step. We're an appless platform, so patients don't have to download apps, and we make it easy for caregivers and others in the patient's family to be able to receive instructions as well. As a result, I'm proud to say we've launched a platform about 2 years ago, and to date we have over 30 hospitals working with us, over 10 million patient interactions, and some real meaningful results in terms of improving operational efficiency, decreasing no-shows, decreasing cancellations, improving patient experience. And because of all these results, all of our hospitals that we work with have grown with us from one department, one use case to enterprise-wide, and we now have over half a dozen enterprise-level contracts with hospitals. Our team is made out of technologists, physicians, myself, I'm an internal medicine doctor, that really felt the problem on both sides. And we went through Y Combinator, Mass Challenge, very excited to be a part of HealthTech Arkansas. And I'm proud to share that just 2 weeks ago, we were acquired by Philips Healthcare. So now we're a subsidiary to Philips, but continue to operate independently as our own entity, so I can continue to serve the customers as we have before and continue to grow our customer base, hopefully with lots of great hospitals here in Arkansas. So thank you all very much.
Hi, I'm Dr. Mitesh Rao. I'm one of the co-founders and the CEO of Omni. So a little bit about my background and the company itself. I spent most of my career as an executive at big academic medical centers. And one of the biggest challenges was always budget season, trying to figure out how we were going to battle ever-shrinking margins, how we were going to find more in the budget to be able to innovate or take on new programs that we wanted to build. And healthcare as a business as a whole is becoming more and more challenging. And this is something we consistently see. Now, as the country heads into what's likely going to be a recession, most organizations are thinking about how they're going to shore up their finances. How are they going to be able to continue to provide great clinical care to the communities they serve while still paying the bills? And the other side to this, too, is that organizations like hospital systems, hospitals, multi-state provider practices, they generate an incredible amount of data exhaust, non-patient, non-HIPAA data, data on how their organization operates, how their supply chain uses products, the type of information that's not patient level, but could be incredibly powerful and valuable to the manufacturers of those products. And those companies, well, they're eager for that data, and they're willing to pay top dollar for it. If we talk about data being the new oil, hospital systems are sitting on incredible wells of it, and it's time we start tapping it. Enter Omni Health. Omni acts as the compliant, secure, ethical, and legal intermediary that ensures that organizations can take that ambient data that they've been sitting on, terabytes and terabytes of it, and turn it into a novel revenue stream. And we're talking a considerable amount of revenue now on top of those ever-shrinking margins. Data flows through Omni to pharmaceutical manufacturers, device manufacturers, private equity that's betting on the environment, and revenue flows back through the marketplace. Pretty simple. We work with any organization very quickly. We start with historical data. There's no data lift. There's no cost, there's no ask of the organization. Simply sign a data agreement with us, give us a year of historical data, let us show you how we can stage it on the marketplace, and let us show you how we can make you money. And it's governed and completely compliant on your side, so you can take your data off at any time. We've been growing quickly. We've got data from over 1,000 hospitals now on the Omni platform and work with hundreds of pharma manufacturers. And we are looking forward to working with quite a few of the great providers that are part of this accelerator and partnered here in Arkansas. So thank you very much, and I'm happy to, of course, answer any questions afterwards.
Hi, thank you. My name is Matthew Benet, and I'm the founder and president of 2 Cents. So before I start today, Jeff asked me to explain, from my perspective at least, why this program is different from other ones that I've experienced. So I thought about it for the 5 minutes before my talk, and I think the best way to really explain that is to tell a story about what it's like for us to do a clinical trial in California. So it starts with trying to set up a meeting with the doctor, and that might take 3-6 months. Maybe he shows up or she shows up, maybe not. Once the meeting is set, there's usually a process where you have to fill out an IRB application. That takes another 6 months. Then you're negotiating with the budget division of the major hospital, another 3 months. And before you know it, a year's gone by. And so here's how it's different here. It starts with Jeff sending you emails at 10 o'clock at night, my time in California. So he's the one who's driving this program. He sets up this incredible symposium where the governor speaks and the mayor of Little Rock, Arkansas speaks and tells us as entrepreneurs how important it is. Then we get an opportunity to sit down. I sat down with Jackie, and over the course of an hour and a half, we hashed out a really innovative clinical program. I have doctors coming up to me, Dr. Jones, with novel and innovative ideas on how to modify our sensors to better detect the things that he is interested in. And that's how it's different. And all this happened during the course of 2 or 3 days. So thank you, Jeff, for setting it up, and thanks for the opportunity. So my company is 2 Cents, and at our company, our objective is to make body-worn vital sign monitors that measure all vital signs and hemodynamic properties, things like stroke volume, cardiac output, and fluids in the patient. We're motivated by the changes in healthcare wherein patients are spending less time in the hospital and quickly move to the outpatient environment. So the idea is, how do you monitor these patients as they transition from a healthcare facility full of highly trained clinicians to the home environment? When they're in the hospital, patients typically wear vital sign monitors or vital sign monitors and hemodynamic monitors, things that have implanted catheters actually in their heart. Those typically have wires and cables, clips on your fingers that measure different parameters, boxy systems that live by the side of the bed. There's just a lot of stuff. About 10 years ago, I invented the product that's shown on the left. It's called the Visi Monitor, and that was my first attempt to free the patient from all the wires that connect them to these boxy systems. So we invented a system that was worn entirely on the body, measured blood pressure along with a few other parameters, but it was still expensive. It still cost over $10,000, and there's clearly a lot of stuff there. So we tried to solve that problem at 2 Cents, and we do it really with 2 different product lines. The first is our COVID necklace. It's designed to reduce hospital readmissions for heart failure patients at home. It's a device that costs a few $1,000s. It's worn on the patient's chest. It measures early predictors of heart failure like stroke volume, cardiac output, and fluids, sends those data along with conventional vital signs wirelessly to a cloud where we do analytics to help predict the onset of heart failure. The other 2 products are patch-based products that are meant for hospital use. The one in the middle is our light version of the patch. It measures all vital signs except for blood pressure. And the one on the far left is our full-blown patch, which in addition to basic vitals like heart rate variability, respiration rate, skin temperature, and oximetry, it also measures blood pressure along with stroke volume and cardiac output, all from the chest. At 2 Cents, we're still a relatively small company. We have 14 people total. We're very strong in technology. We're just launching our sales efforts. Experts in cuffless blood pressure, that's really been our focus for the last 3 years. And we're seeing traction in the commercial world after about 5 years of development. Just closed large contracts with dialysis companies, companies doing respiratory monitoring, pharma clinical trials, a big contract with a company that does infusion systems where we measure vital signs along with that. So we're taking flight, and we look forward to working with HealthTech Arkansas. And what I'll do is close by working with my colleague Sam. He's wearing our COVID necklace. His heart rate right now is 120 beats per minute, so that's really high. His stroke volume is 78 milliliters, cardiac output 9.4 liters per minute. So he's probably a little bit more anxious than I am right now. But I just wanted to show you how the technology works, and thank you for your time. I appreciate it.
All right, so now you can see why we're excited to have these companies in Arkansas. Just a fantastic group. I will close by saying just one more quick thing about my home of Arkansas, because I see Jerry Adams sitting there, who's Mr. Arkansas, or Grandfather Arkansas, as it might be. So, you know, several of our companies mention this, right, which is it's a different place. They feel the hospitality when they're here. They see how easy it is to work with people. The main way that we find people for this program is I travel. I go to healthcare venture conferences around the country. And when I do that, the very first question that people ask me is, how in the world did you get 9 providers to agree to do pilot projects with early stage companies, because they can't even get one hospital in their state or their city to do it. So how did you get 9? And my only good answer for that every time is it's Arkansas. We all know each other. We're collaborative. We work together. If first of all, it's so much easier for me to just call a hospital CEO and get that meeting. If I'm in Boston, I don't even get the meeting to begin with, right? And once we get the meeting, we can talk to people, show them what we're doing. And so it is a collaborative place, and it's different. So for our 6 companies, what I would say to you is not only do we want to work with you, we will work with you. We'll make you as successful as you can be. And for all of you out here tonight who are native to our state, there's some way you can help these companies. You have a contact or a connection you can make that can help their path and help them to develop their work here. So thank you everyone for coming. If you're on the selection committee or you're in this year's cohort, if you'll kind of come to the front, we're going to get a couple of pictures with the governor, but we'll also be around here. We'll stay around and chat as long as you want to. Thanks everyone for coming tonight.